Hello, everybody. We're here for another Thursday office hours with Nurse Linda.
Absolutely. Come on in. Come on in. You guys have submitted questions already. And of course, we encourage you to submit questions live because Terry's watching for those, my partner there. And I just answer away. You know me, I'm very informal. You can ask anything you want. It is the start of PCOS month. So any of you guys think you have PCOS, been diagnosed with PCOS, I'm a PCOSer. Please feel free to throw those in. What are my little disclaimers? I like to mention that if we don't get to your question or you have a very specific question and maybe you don't want to put it in live here, I'm always sitting over in Ask an Expert. I'm pretty much from 8 in the morning till 8 at night. I answer those quickly. I know you guys must sit here.
Dedicated.
I know, think I obsess about it. And I do. So you are right. All right, let's get started. And we'll start off. The first question I have actually is kind of PCOS. Somebody is asking if Vitex will help with PCOS. Vitex, which is, I think, the name brand for chasteberry, which is basically just a herbal supplement. The short answer is no, Vitex really isn't a PCOS thing. Vitex is supposed to be good. If you have low progesterone, what it does is it's supposed to lower your prolactin, which in turn helps raise progesterone. So for gals who might have progesterone deficiencies, Vitex or chasteberry is supposed to help with that. Again, it's one of those like herbal supplements. So you're always going to have a handful of people who say, yeah, like it'll work for me. Then you're going to have a handful of people who are like, duh, nothing. So hard to say. I will say this though, for PCOS, inositol, myo-inositol, I-N-O-S etol. That is, you could buy that over the counter. That is something, a good supplement for PCOS. I take it still now.
Just check with your doctor.
For your supplements, yeah, it's always good. But I mean, these are pretty safe. I wouldn't have you on medications. So medications are like metformin is a prescription medication. That's also good for when you're PCOS, but that is a doctor prescribed thing. I always like the sex questions. Is there a better time of day to baby dance? My husband works second shift and gets home late, so about 1:30. Is it okay, or should we be doing it first thing in the morning? And it doesn't matter. Whenever you can, because you guys know if you've got a membership, one of our great memberships, and you're over, with your question credits over and Ask an Expert, I'm always preaching lots of sex because this is like as simple as it is. I need sperm to meet the egg. I need tubes to get the sperm to it. And there you go. Everything else is out of our control, like whether the egg is normal, whether it'll make a baby, whether it'll implant. That's all stuff way out of our control. But what we can control is getting the sperm in there and timing the sperm. So that's what our whole business is about. But what you guys have full control over is the timing of your intercourse. So no, the short answer is no, there's not a better time of day to have sex. What is important is to have enough of it. What I like to preach, and this might not be possible, and I totally get it, but it's good to know the goal, is start having daily intercourse about 5 days before you ovulate. So how do you know when you're going to ovulate? Well, if you have fairly regular periods, then you really do know when you're going to ovulate, because based on when you think you're getting a period next, you're going to ovulate about 12 to 14 days before that. So that'll give you a rough estimate. If you've already been doing LH testing all along, you pretty much know what cycle day you ovulate on. But if you don't, that's a cheat way. If you know when your period is, 12 to 14 days ahead of time. So now you know when you're going to ovulate. So look at the calendar 5 days before that. Try to get in daily intercourse if you can, all the way up until the day after ovulation. Because these sperm live in your body for up to 5 days. So that's why, we're kind of like preloading with sperm. So that way they're all up in the tube and they're all waiting for this egg to come out just to jump her. And that's okay. That's what we want. And then also an egg lives for about a day after we ovulate. So it's always good to try to get sex in a day after we ovulate too. Okay, good question here. Somebody has recently had a miscarriage, and I'm always so sorry about that. Just makes me sad every time I have to say that. Now, what she's looking for and what her question is about is, what does my HCG level have to get down to before I start ovulating again and kind of resume back to normal? Well, basically, when your HCG is 5 or less, you're considered to have no HCG around. Now, she mentions that it was now down to 20, so it's getting there. Now, how your body resumes back to normal is going to be very individualized, right? So you will ovulate. You don't have to wait to get a period after a miscarriage to start trying again, because in order to get a period, you have to ovulate first. So I want to catch every ovulation cycle I can. So after you miscarry, you're probably going to have a bleed from that of some sort. Start doing your LH testing again. Now, how soon will you ovulate? It could be in a couple of weeks. It could be 6 weeks. It all depends, because not only do you have HCG you're getting rid of in your body, but you have a lot of other hormones. Your body was all psyched up to be pregnant. So now it's got to re-straighten out all of its communication to get you back into a getting pregnant mode, right? So that's why you got to give it a little time. There's no one rule, except to say basically you're considered to be not pregnant when your HCG is anything that's 5 or less. Also, to follow up on that, can there be physical signs such as cervical mucus that might be compromised or something by a miscarriage? Seeing no physical signs of ovulation almost 6 weeks later, right? So that's what I was just saying, right? So cervical mucus comes from estrogen, and in those first 2 weeks of your cycle, you're growing your follicle, which has your egg in it, for, like about 10 to 12 days. And while that follicle grows, before it releases the egg, it's putting out estrogen. So for 2 weeks, your body's like accumulating estrogen. So when you get closer to ovulation, you start seeing the cervical mucus, because that's what causes the cervical mucus, is estrogen. So again, if your body hasn't snapped back yet to grow a follicle, you're not going to have estrogen around, and therefore you're not going to see the cervical mucus. There's nothing to do to hurry that up. We have to respect our body, and we have to listen to it. It knows what it's doing. Do OPKs, this is a good one. Do OPKs always test positive in early pregnancy? Okay, so you guys have kind of found or stumbled upon the little trick as you get towards, when it's time for ant flow, you're in, 12 DPO, 13 DPO, and you have found that if you do your LH tests, that you might find them coming back positive. And that, of course, is your way of indicating you're trying to find out. You want to find out if you're pregnant. So, yes, that can happen. It's not reliable. We do not recommend it. That's not a way to find out you're pregnant. Go do your home pregnancy test. But that being said, I am not going to ignore the fact that I understand OCD behavior and the nature of being horribly impatient in the 2-week wait. To me, it's like all bets are off on the 2-week wait, because the 2-week wait is horrific and you do it every month. So I really want to cut you guys a lot of slack here, because the truth is I would probably be doing LH tests the same way you guys are to see if I'm pregnant. Just know what's happening is, if you have the pregnancy hormone HCG around, HCG and luteinizing hormone are really very similar chemically. As a matter of fact, I'm from the IVF world, and in the IVF world, in order to get a girl to ovulate or release her eggs from her follicles prior to an egg retrieval, we would have them take an HCG injection, because it acts like luteinizing hormone. So for a bajillion years, we've always known there's a very much a similarity between LH and HCG. So the short answer is too late, but yeah, your LH test can be positive right before a period, if indeed you're pregnant. But again, consider it almost like an old wives' tale. You didn't hear it from me, but I'm telling you what is happening out there. One thing I do want to push, probably more than anything, is try not to test early for your home pregnancy test. And what I mean by early is 8, 9 DPO. Because what I'm finding is you guys are breaking your own hearts when you do it. Because even the pregnant girls who are pregnant, and of course you're impatient, so you start testing. Even when they're pregnant, most of the girls are not getting positive pregnancy tests at 8 and 9 DPO. I know you think they are because those that do get it, and some do get it, they're posting about it or they're talking about it or they bring it up anecdotally. So that makes you guys think, oh, everybody must be getting it. The reality is most of the girls who are not getting it aren't really out there talking about how they're not getting it. So you get this skewed version of what reality is. And it's just heartbreaking. I know you keep thinking, yeah, but I just want to see that positive. But when you see a negative, you're devastated. And again, I see that in you guys all the time. So I tell everybody, don't test until 12 DPO. Just hold off on your impatience, and just wait. So that's my lecture about that. Terry, you got any questions? Go ahead.
I do. I just want to say DPO is days past ovulation for anybody who's a newbie.
Thank you.
A lot of abbreviations out there.
Absolutely.
Yeah, we have a lot of questions. I'm going to throw you some of the shorter ones. And then if we get through those quickly, then maybe I think you'll need to read the longer ones. We've got some kind of case ones.
No problem.
We just got one. Should we discourage our partner from masturbating during ovulation week? Or is it kind of wasteful, basically?
Okay. Well,
that's a good question.
Yeah. During the 5 days that I'm telling you, I want you to have daily intercourse. Listen, if you got the kind of guy who's like, and on top of that, I want to masturbate too, tell him hold off because you're giving him daily sex. But again, outside of the fertile window, let him have at it. I don't care. But within the fertile window, yeah, I'd rather you be having sex every day. There's no advantage to you for him to be masturbating on top of the sex every day thing.
Okay, a couple questions about pregnancy. I'm not sure if it's the same person. I have a lot of lower back pain, one person says, and cramps, but the pregnancy test is negative. So I guess looking for some feedback on that.
Yeah, well, so the problem there is that once we ovulate, that old follicle called the corpus luteum starts putting out progesterone. So progesterone is what is predominant in the last 2 weeks of our cycle. It's the pregnancy hormone. It's the hormone that gives us PMS. Progesterone is a heavy, not all of us react to progesterone the same, but we have it around after we ovulate. So the symptoms from having progesterone around are pretty much the same symptoms as pregnancy. So that's why it's so easy, to mix them up. When you're trying so hard to get pregnant, you look at progesterone symptoms as, oh, maybe those are pregnancy symptoms. And if you're not trying to get pregnant, you're like, oh, darn, my PMS is coming around already because you're not even thinking about it. But so it really is generally progesterone symptoms that are causing that kind of stuff. Okay. And the truth is that once you ovulate, let's say you ovulate and the next day is, 1 DPO, days past ovulation, you're probably not even going to implant until 6 to 8 DPO. So again, for those gals who think they have symptoms between days, 1 and 8 DPO, you're not having any from pregnancy, I'll tell you, because you haven't even implanted yet. But you might be having symptoms, but it's progesterone based. Just wanted to add that.
Okay, and I think we have some more kind of related details. We have a couple of questions about trying to get pregnant and having thyroid issues. One person says, I have an unregular cycle. I'm using thyroid medicine, 75 mg, trying to have a baby, my first one. Peak was August 18th and got a positive on August 23rd, but negative the next 2 days. And then another positive urine test on the 30th was negative, and now keeps getting negative, cramps and pain, lower back. I'm not
real clear, Tara. Are we saying when we're saying negative and positive, are we talking about pregnancy tests?
I think so. Let me double check here. Yeah, because peak was the 18th. Yeah, HCG, sorry. HCG test was positive, and then it was negative, and then positive, and then a urine test on the 30th was negative, and it's been negative since, it looks like, but still getting the vaginal discharge, peeing more than normal, back pain and cramps. I think that might be more information from the last one.
Okay. So does it sound like we unfortunately had like a chemical pregnancy? I mean, we had a positive pregnancy test. We've got some of the symptoms of pregnancy, but now we're consistently having negative home pregnancy tests. I'm guessing Aunt Flo hasn't showed up yet. Right? It doesn't look like there's been a period
That makes
yet.
sense.
Yeah. So it sounds like, and again, Aunt Flo will probably be delayed just because if you were positive, but it sounds, now certainly, going and getting a blood test at your doctor will take care of this decision for us, and we'll know if we're pregnant or not. But a chemical pregnancy means you did implant, you did get pregnant, but it didn't stay. We tend to lose those pregnancies fairly early on. Sometimes you don't even know you were pregnant.
So would you suggest if the period continues to be absent to just go ahead and get the test with the doctor, the blood test?
Yeah, because if you know when your ovulation was, and it sounds like you do because you had a peak, again, you should, either be pregnant or get a period. Those are our only two choices. So it sounds like if we did have a positive pregnancy, I would accept our period being, like up to a week late. But if after that, I might, go to a doc to see what's going on, because I should be getting a bleed.
Okay, we have a follow-up question. Someone's asking, what is a chemical pregnancy?
Good question. It's a miscarriage. It's a real pregnancy. It's a miscarriage. It's just that it's so early on. They call it chemical only because it's only been confirmed chemically, like, in the home pregnancy test. You didn't go have an ultrasound where somebody said, oh, I see the baby in the sac. That's what, then they refer to it as a clinical pregnancy. But again, regardless, you got pregnant and now you're going to have a period and you'll lose the pregnancy. It's a miscarriage. It's just an early on miscarriage.
Mm-hmm.
Still heartbreaking, no matter how you look at it. Yep.
Any other thoughts on the thyroid and chances of getting pregnant? I'm guessing thyroid issues.
Right. So thyroid issues are important. And I'm glad you're on top of it and taking medication. Thyroid issues don't so much make it difficult to get pregnant, but if you have uncontrolled thyroid issues, because inherently when you get pregnant, your TSH tends to go up, your thyroid stimulating hormone tends to go up anyway. So that's why it's important to make sure you're in control, because when it gets out of control like that, you're at a higher risk for miscarriage. That's what thyroid has to do with pregnancy. Not really getting pregnant, but more having a healthy pregnancy. So keep that thyroid in control. Yeah. So stay on your medication, obviously.
Okay. I have a couple of ovulation symptoms questions. Someone says, I got my peak today. I have horrible cramps and sharp pains when I press on my lower stomach. Is that normal? Came off birth control in July.
And we're getting a peak today. Good. So if we're getting a peak today, that means we're ovulating tomorrow. And remember, I mentioned you have a follicle that grows bigger and bigger and bigger. And finally, when we ovulate, it releases that egg. But you have a really big follicle sitting there right now. So if you're really close to ovulation, you may certainly be sensitive to that big follicle, and it might feel a little bit crampy and that kind of thing. Some people actually feel when they ovulate too. They get like a, kind of a little stabbing pains on one side or the other when they ovulate. So yeah, that would be, I would say it's due to your large follicle and getting ready to ovulate. Yep.
Okay.
Now, one thing, it sounds like if she just came off birth control in July, so you're probably fairly new to this. Do keep in mind, for any of you out there that might be new to Premom and doing the LH testing, this is like a real predominant thing I see in my questions all the time, is that Premom is a smart app. It's got intelligence to it. It actually learns about you. It doesn't just report yes or no on things. It is studying you and learning about you. So in that first month, it's really busy learning about you. So and of course, I'm just going to give a down and dirty what to expect when you're doing LH testing, but you start after your period's over. And this is important in the beginning. I do want you to test every day, usually in the afternoon, evening. Some people say it works for them in the morning, but we tend to have more LH around in the afternoon. So you're doing the test every day and you're going to get lows. You're going to get one low after the other. Perfectly normal. Now, some of you may run a little higher and get some highs. PCOS people do that. Again, doesn't matter. I don't really care about low and highs. I don't care if you go low, high, low, high, low, high, you have a bunch of lows. I don't care. But eventually, as you get closer to that fertile window, you may notice you're going to get a couple of highs before you hit your one single peak. You will only get one real peak because you only have one real LH surge in a menstrual cycle. Now, the app might change its mind if you're new to us. For example, let's say you get a 1.1 and the app goes, yes, Terry, you got a peak, and it calls it peak. Now keep testing for me, okay? Because that might not be the real one. Maybe a day or two later, all of a sudden, Terry gets 1.3. So now the app goes, uh-oh, erase that other peak. I'm going to turn that into a high, and I'm going to give you peak now. That's because the app is learning about you. Now, next month, when Terry gets a 1.1, the app's going to be like, psh, I know that's not your peak. You tricked me last month. And it'll probably call it a high, and it's waiting for the 1.3-ish. Again, that's how the app works. It learns about you. So don't be surprised in that first month when you're using it that you might see some of that kind of movement. And of course, the app has that nice, on your chart, that purple shaded area. That's just a prediction based on what you told the app your cycle length is. So it's saying, maybe you might ovulate around here. Don't worry if you don't ovulate or peak in the purple shaded area. That's just a prediction that you'll ovulate whenever your body wants to ovulate. So don't worry about that. And as you get closer to that purplish area, sometimes we recommend testing twice a day because some gals get that peak really quick. Like it goes up really fast. And if you only test once a day, you might miss it. So as you get to that purple shaded area, getting closer to what probably is going to be ovulation, go ahead and test twice a day. Please don't waste your money and test 3, 4, 5 times a day. 1, you're wasting money. And 2, you're going to probably confuse the app. There's no advantage to that. I know I would probably do something like that too, and I would need somebody to tell me not to. But yeah, twice a day is perfectly fine. So I hope that explains a little bit about the peaks and when you're new to the app. Sorry, I kind of went off on a tangent there.
Yeah, no, actually, I want to clarify a little bit. And I haven't checked with the development team recently, so I don't know if they've made some changes with the algorithm. But generally what happens actually is the app is looking for a peak at about 0.8 or higher, because that 1.0 is that typical cutoff that's close to the 25 MIU/mL, but it gives you a little leeway room because some people don't quite make it that high. But then if in the next cycle, the app sees that you didn't get a peak, it'll be like, oh, you must be peaking lower. So it'll actually lower the threshold for you. So that's why sometimes people get confused because they're like, this wasn't a high last cycle. Why is it a high this cycle? It's because the app is adjusting to your pattern. And like Nurse Linda said, it's always looking for the last highest results, and you are different from cycle to cycle. So, if you get a 1.1, it's like, oh, this is higher than 0.8, you must be a peak. And then if you keep testing like you should, and you have continual highs, like some women have a gradual onset and have a very long surge, and then you get a 1.5, then the app will say, oh, like Nurse Linda said, never mind, this is your peak. So it's designed to look for something above 0.8 and a drop. It's looking for that, the peak of the mountain. But if you're going like this, then it'll readjust because it's always looking for that last highest result. So I'm very proud of our app. Our app really is like innovative, one of a kind out there. So yeah, I'm very proud of it. But I want you guys to understand, and Terry just did a great job of explaining it as well.
So yeah, do know that this is a smart, and like she said, I get this question. Terry hit on a good one there. People will tell me, oh, my number is lower, my peak number is lower. Does that mean I'm heading towards menopause? Or it's like, it doesn't matter what the number is. Plus the app, never mind what the app's doing behind the screen, kind of thing. As long as it says you peaked, and that is good enough kind of thing. And again, highs do not mean peak. I know usually high means something very special to us, but highs don't. A lot of gals will be like, I'm on my third surge this cycle. And it was like she had 2 highs and a peak. So I get it. I get why she thinks that, but that's not the reality of it. Yeah.
Yeah, on the low end, I have heard of people getting pregnant with a ratio of 0.5 or 12.5 on Premom. It's unusual. Usually you're aiming for around 1.0, but some women just peak lower. Everybody's different.
You betcha.
You want to make sure you keep testing, though. Don't think you're at 0.5 when you're done. So a lot of women do peak higher, just a caveat.
That's right. That's right. Now, I have 2 questions here. I could probably tie together a little bit. Somebody is asking me about how reliable are proof strips in testing progesterone. And then somebody else is asking, how do I know if I've ovulated? So I'm going to tie those 2 together. Now, Prove is not our product, so let me get that right out there. I can only tell you what feedback I often get. And again, it can just be I'm getting a skewed population of gals where it's not working, but they're getting very frustrated because it's not reading their progesterone right. And they clearly ovulated. They had a lovely peak. Their BBT, basal body temperature, went up. They get periods. So I don't need to test anything. I know you have progesterone right. And they'll tell me I'm getting one proof negative after the other. So I can't advocate using these right now just because I don't know enough about them. I just know the feedback I'm getting. But to now lead to the second question, which is how do I know if I've ovulated successfully? Well, you get your peak, and all that means is you had an LH surge. That's all that means. The rest, we are speculating. And that is that you actually did ovulate and release an egg from that LH surge. And that happens about 24 hours later. Now, this is why BBT is important. BBT doesn't help you get pregnant. As a matter of fact, a lot of gals use it to not get pregnant. What BBT does is it responds, your temperature goes up because progesterone is around. And that follicle that released the egg, it will start producing progesterone after it releases the egg. Well, how do I know that progesterone is around? I don't, but I can take my temperature, and if my temperature tootled along prior to ovulation low, and then after ovulation it went up, that shows me that I did indeed ovulate. Now, some gals are curious, how do I know my progesterone's good? How do I know what my levels are? Well, we don't, is the short answer. The long answer is, look at your luteal phase length. That tells me something. Your luteal phase, that's the time from when you ovulate until your period comes. Look back at your previous cycles, should be a minimum of 10 days. Usually it's more like 12, 13 days, minimum 10 days. If it's less than 10 days, that's too short. You have what's called a luteal phase defect, and that's not enough time to implant and stay pregnant. And again, usually it means a deficit of progesterone. Now that's easily remedied. You just go to your doctor and he'll either give you oral progesterone or he'll give you progesterone suppositories to take vaginally or progesterone creams to insert vaginally. So problem solved. You just take progesterone and there you go. But yeah, that the BBT is really the down and dirty, easy way to know you ovulated. Having a period eventually also confirms that indeed you ovulated. Anything to add on that, Tara?
No, that's great.
Okay. Somebody's asking about exercising. Well, this is a good question. I get this. While trying to conceive, can that harm implantation? I recently started running and I'm worried to overdo it. Okay, well, again, I'm going to give short answers and long answers. The short answer is, if your body's used to exercising, then please do continue it. Exercise offers us so much good stuff, good endorphins. It just is good for our mental health. It's just good all around, right? So don't stop it. And again, I don't care if you did jumping jacks every day. Nothing is going to make you lose a pregnancy that implants if it's meant to stay. Women have to go have procedures to unimpregnate themselves. If there was an easy way to do it, like run around the block, a whole bunch of teenagers would be outside running right now. It's not how it works. So no, you can't really make yourself not implant. That being said, during that our time when we're trying to conceive, don't go join boot camps and stuff where you rack your body up, and you're in agony and you're beat up. And even though in general, that's probably for the long term going to be good for you, right now your body's focused on trying to heal, catch its breath, all of that stuff. So don't start new stuff right now, but whatever you're used to, by all means, keep doing. Here's a good one. Should I count spotting as day one of my period or wait for a proper bleed? Usually nothing really matters that much by a day. Now, some gals are, I spot for 3 days before I get full flow. There's spotting, and then I wear a pad. So generally, if it really was just, I have a day where when I wipe, I see a little bit, and then I bleed the next day, we'll count the next day. But if you have like enough spotting to have to wear a panty liner, I'd count that as your period. But like I said, don't stress about it. Even if you're counting your cycle days for something like taking Clomid or Letrozole, 1 day won't make a difference. So it's okay if you're wrong about what your body thinks is the first day of a period.
Yeah, and I think the key is trying to stay consistent if you can, because the app is basing its predictions, if you're using Premom, on your period length as part of your full cycle length. So that's why you may want to be consistent with what you're logging.
Somebody asked thoughts on the pull-out method. We're not trying, but if it happens, it happens. Well, of course, pull-out method during sex is generally used as a form of birth control. Not necessarily a really good form of birth control, though, because as we all know, men have pre-ejaculate, so sperm can get loose. So if you're okay with getting pregnant, then fine, keep doing it, because you're right. It probably will prevent you from getting pregnant. I'm over here pushing girls to have sex every day for 5 days. And, most likely if you have sex and you pull out, you're not going to get pregnant, but you certainly could. So what else do we have here? I've got some age-related questions. Advice on naturally trying to conceive over the age of 40. Really nothing different than we've already talked about. Again, it really does keep it simple, boil down to get sperm to the egg. What I think is always important is to understand and set yourself up mentally so you're not. So, at 40 years old, you've probably got naturally about a 5% chance of getting pregnant any particular month. So and I've seen beautiful cycles, ovulation, BBT, gorgeous, and they don't get pregnant. Now, please be highly disappointed. Totally get that. But don't be surprised. Don't be so, oh my gosh, there's got to be something else wrong here. It's not working. Statistically, I don't expect it to work. But the reality is plenty of women get pregnant over 40. Just keep doing, but you don't have time to fool around with doing LH testing in a halfway manner. You got to be on your game, because at any minute, one of these months, you're going to ovulate you still have good eggs. Of course you do. You guys know, I always tell, I got pregnant and had a baby at 45 naturally. So, it was a 1 in a million shot, but it happened. So of course it can happen, and it can happen to you. Why not? But you got to be on your game. You have no time to fool around. You got to do your LH testing religiously. You got to have that sex religiously in the fertile window. So that's all. You got to take it seriously. Also, I encourage you, if after 6 months of trying, if you're really, serious about having a baby, then you might want to start looking into a medical opinion. Maybe we need to start getting testing. How do we know the sperm is working? We just, at 40, we just don't have time anymore to be waiting. So again, give it a few good months. And then if you haven't had sperm tested, get a semen analysis. If your tubes haven't been tested, get an HSG test. You might want to even consider talking with your physician about doing insemination cycles, because these are the things, insemination, IUIs, will increase anybody's chance of getting pregnant. They're timing it and they're injecting the sperm into the uterus. So yeah, that would make it easier for anybody. Again, it doesn't raise your odds tremendously. Look, we'll take anything we can get though, So that's all. Just keep your expectations based in reality. But it can happen, so don't give up.
Love that.
Is there a best amount of time to wait if we need to do our LH testing twice a day? Terry, you want to answer that one?
Yeah, sure. We recommend at least 3 to 4 hours between the testing. You could test in the late morning, you could test in the evening. It really depends on you finding your pattern. I know we normally don't talk about testing more than twice a day, but there are some women who surge in 4 hours. So if you're not finding your surge at all, you might want to test more often until you figure out what's going on with your personal pattern. I'd say in general, though, if you want to test, late morning and then early evening, spread it out a little bit, that's probably fine for most women.
Okay. Somebody's saying they have varying cycle lengths, long cycles, consistent higher LH. So that sounds like PCOS. PCOS is just rough. There's all kind of varying degrees of PCOS. Some gals have PCOS and they ovulate every 45 days. So they might have to do their LH testing a little bit longer to see their peaks. If you're like me, when I was young, I didn't have periods at all. So there would be no point in doing LH testing because there was nothing to test for. So it varies. And we do tend to inherently have higher LH levels just in general. Like normally in normal women, non-PCOS women, LH levels are low until it's time to surge. But in us PCOS women, we have like our baseline LH level tends to be higher. It's one of the ways they diagnose PCOS in women as well. When you get lab work done, you'll have a higher LH level than your FSH level. And that's a diagnosis for PCOS. What else? You got any other good questions there, Tara? We got any live ones coming in?
I do.
Go, girl. Go, girl.
Gotta make sure we knocked out some advanced ones, so we have quite a few live. Let's do it. We had one kind of a follow-up to what you were talking about in the beginning as far as miscarriage. This person said the HCG almost dropped to 0 and spotting finally stopped. When should I expect ovulation and period? Can you?
So yeah, if you finally stop, if I heard right, Terry, they finally stop bleeding and spotting after the miscarriage. And when can I expect to ovulate or get my next period? Mm-hmm. So that's a good question. And everybody varies. Now, you could fall right back into your normal pattern. I do recommend you start doing your LH testing, because if you're that gal who's going to ovulate in the next 12 days, you don't want to miss it. And there's no reason you can't get pregnant after you have a miscarriage. You can get pregnant the month after. I know there's mixed messages about everything out there, but you can. I did. I got pregnant after I had a miscarriage the following month. So yeah, you can do that, but I would do your LH testing. But do not be surprised if you're doing your LH testing and nothing. Maybe it's going to take 4 weeks for your body to snap back. That could happen because remember, your body was in a hormonal mode to be pregnant. Now it's not. Now you are mentally ready to go, but it might not be. And there's nothing we can do to hurry that along either. We just have to wait.
Awesome. And then I think this next one, you may have answered.
Okay.
And it's long. I'm going to shorten it a little bit. So basically, she's sounds like she's in her 2-week window, 2-week wait. I always confuse those two. And they're both W's. Anyway, she's wondering when she should take a pregnancy test. And it sounds like she has some symptoms that could potentially be pregnancy. And she's asking 10 PO or 12 DPO. And I think that's what you suggested, right? At least 10 PO.
Yeah, I mean, I do. I mean, if I want to keep you mentally safe, I recommend 12 DPO. But that being said, some gals literally won't. They're pregnant, but they won't get a positive home pregnancy test until literally their period is late right now. So 14 DPO, let's say. And again, they're as pregnant as anybody else, because remember, we don't know exactly when you implant. Generally, you will implant 6 to 8 days after you ovulate, but it could be as long as 10 to 12 days after you ovulate. So obviously, you're not going to get a positive early on. You haven't even implanted yet. You have to, remember, I'm going to go back to health class. You know, the egg is ovulated from the ovary. It kind of saunters into the tube. All the sperm are waiting in the tube. Some knuckleheads went the wrong way. Others are swimming backwards. You know, we know that, but they're waiting in the tube. That egg gets in there and they start doing their thing, and the egg lets one in. Now the egg is on a trip to the uterus, and it's going to take about 5-6 days before it fully gets down to the uterus. Now it's been fertilized and it's growing and dividing 4 cells, 8 cells, 16 cells. And when it's about 6 days old is when it implants. But again, how long this journey takes, it could take a little longer, you know. So that's why testing so early, like 8 DPO, I'm telling you now, don't waste your money. You're going to get a negative. Even though I know every blue and purple moon a gal gets a positive, you're not, and you're going to be devastated. And I don't want that negative energy. So I really do recommend you wait till like 12 DPO. Did that answer that, Terry?
Yes.
Okay, good.
I was just looking up some stuff for the next question. I think you may
Linda, I love you too.
I love that. Someone was asking about 40 years old, and I think you touched on this already, but also was asking about supplements, and I was just scrolling through the app really fast. We have so many good videos on the app, so many that I think people don't realize all that's there. So do make sure you check in the more section where they have the blogs and the videos. And I just scrolled through. You have to scroll a little bit down, but there's one that Steph Kagan does that's fertility diet, food, prenatals, and lifestyle tips for getting pregnant. I highly recommend that video. I think we have another one by another fertility expert even further back that just goes through like a whole bunch of stuff. So be sure to check that stuff out.
That's good. That leads to us. Somebody's got a question here. Is there a good, quote, fertility diet? You know, it's the one we're all supposed to be doing, you know, healthy, anti-inflammatory diet, the rainbow foods, all of that kind of stuff. Us PCOS gals, we may tend to be a little more specific because we've got potentially blood sugar issues. Remember, PCOS isn't just an endocrine or a fertility issue. It's also a metabolic issue. So there are, you know, you don't need to be low carb. You need to be good carb, though. You don't want the simple sugars and all that kind of stuff. So yeah, no. The short answer again is no, there isn't a special diet that increases your chances. Just like when people ask about, oh, what prenatal do you recommend I'm on? What's the best prenatal to conceive? Well, no prenatal helps you conceive. Theoretically, prenatal is giving you vitamins. Now, I do want you on prenatals because it's got that all-important folic acid and DHA, which these are all good for developing baby. And I want your body loaded up on them a couple of months, if I can, ahead of time. But again, per se, do they help that egg and sperm get together? No. Same with your diet. But the healthier you are, the more likely your body is willing to allow. Remember, your body has to allow you to get pregnant. So if you're somebody who is having health issues, or if you're too skinny and not healthy, or if you're too overweight and not healthy. And listen, I did not say you can't be over. There's plenty of us that are overweight and we're still healthy, but you know what I mean. I'm like, you're just not healthy. You have gut, issues, immune issues. Your body may not allow you to get pregnant simply because a pregnancy is very taxing on our body. And it's not going to let you compromise your general health so you can have a baby. So yeah, you've got to be in that general healthy-ish place. You don't have to look like you're a aerobic instructor. That's not what I mean at all, but you know what I mean. So yeah, we should all be, cutting back on processed foods and fast foods and all of that. But I like to believe there's a balance everywhere, because if I have somebody who is stressing about what they're eating, diet's great, but they're stressing about it. I don't like that more than I do the bad diet. So really try to keep those stress levels down and don't worry so much about stuff. Most of this is out of your control. What else we got, Tara?
Yeah, can I give you 3 more and then we'll
Please.
jump back? This is a good question. I usually ovulate day 15 or 16, but if I ovulate day 19, does that mean my period will come late too?
Yep. Your period is tied to your ovulation. Because remember, you ovulate, you start releasing progesterone. If you don't end up pregnant, like about 12 to 14 days after you ovulate, your body goes, you know what, dump the progesterone. There's no point in it. And so your body stops producing progesterone. And it is the stopping of progesterone that brings on a bleed. So yeah, your period is tied to your ovulation. So yeah, your period should be, if your period is usually 10 days after ovulation, it'll be 10 days after this ovulation. If it's 12 days, it'll be 12 days after. Yeah, good question.
And we have another symptoms question. I know these are very popular because we all want to know when we're pregnant. We're looking for everything we can.
Absolutely.
This woman said that she was not able to test for ovulation tests because her doctor advised her to take a break. So she's not sure of her DPO. Any thoughts on moderate to strong lower back, almost like butt pain, single-sided pain cramps on CD18 and lighter on CD19?
Well, I mean, it is normal after you ovulate to have crampy or pain on one side or the other. That's because, remember, that follicle you ovulated from stayed alive. So it stayed nice and big because it's got a job to do, and that's to produce progesterone. So sometimes you can feel that. Some people are more sensitive to others. But again, progesterone causes these kind of symptoms. And again, they vary, on day 18. And you know what? All of this stuff varies. Maybe you were really hydrated on day 19, so you didn't have as many symptoms, or, maybe you moved around a lot more on cycle day 18, so they were more pronounced. So there's so many variables. Try not to microanalyze one day to the next because there's just too many variables.
Great. And then we had a pregnant. We had a question. Can I be pregnant and have my period? I'm wondering if she's talking about spotting, but can you touch on any kind of blood?
Yeah, well, that's a really good question. A period is different from bleeding. By definition, a period is what I just described a minute ago. It is tied to the reduction of progesterone. That's a period. Like even, if any of you have been on the pill in the past, what happened after you took your last pill? Maybe you took placebos, maybe you didn't take anything for 5 days, but what happens a couple of days later? You get a period because you stopped taking progesterone. Those are periods. They're hormone related. Now, spotting and bleeding can happen anytime. Take a gal who's pregnant, fully pregnant, and you read it all the time. She's having spotting, she's having breakthrough bleeding. Those are not periods. Or sometimes you hear about the gal who's, ends up delivering a baby and she didn't even know she was pregnant. And she'll tell you, I was having a period every month. Well, no, she wasn't having a period every month, but she was having some kind of bleeding throughout her pregnancy. And she just thought, she assumed it was her period. So yeah, you can have bleeding while you're pregnant. You can have spotting while you're pregnant. It's very scary because, of course, that's, can be a symptom or a sign of a miscarriage coming. But 25% of pregnant women will bleed and spot, and it means absolutely nothing because, of course, the whole cervix and all that is engorged with blood. And sometimes just the act of sex or a bowel movement or mopping and vacuuming can cause blood vessels to break, and you'll have that kind of spotting or even bleeding. And it's perfectly fine. You're not losing the pregnancy.
Cool. Do you want some more live ones, or do you want to go back?
Go, girl.
At like
I think I did all mine. So yeah, by all means.
Okay. I'm going to hop around a little bit now because we had a lot of new questions come in and some interesting new questions. Let's see. Do you have anything you can comment about cervical position tracking?
I'm not going to be a good person to ask that because I have a personal philosophy of leave your cervix alone. As a matter of fact, I really wasn't even that familiar with it until recently, where I was reading about, and probably as I was learning about the whole pre-mom thing, was girls reach up and and I guess, Terry, this is what it means, right? They're reaching up vaginally to feel their cervix. They want to see what position it's in. Is it high? Is it low? Is it soft? Is it hard? Is it like the tip of my nose? Is it like my chin? All of that business. I can just tell you, I don't like it. The cervix is the threshold to the uterus, and it is the gateway. The uterus is a sterile place. The vagina is not. I don't really want you contaminating the uterus by poking and prodding. Now, I'm sure most of you know exactly what you're doing and you're very careful, but I really don't see the advantage to it either. For what? I'm telling you, the app is telling you exactly what to do. Whatever your cervix, leave your cervix alone. That's my opinion. That's just my opinion. Leave it alone. So I cannot encourage that. Yeah.
If you do want to check into that more, we do have a blog on that. I know by Dr. Habe. So check that out. I don't personally either check that. I am curious about it, but I haven't actually gone into it as much as I have with ovulation testing either.
I'm always afraid, oh my God, what if a fingernail got in there and I don't know, something, or I scratched myself, or just stay out of there. That's a really special place. The kingdom of the uterus should not be disturbed.
Yeah, it's good to make sure you know what you're doing. And we do have options for tracking it in the app. And I get confused about, it's backwards for me for some reason, because it's high when you're fertile. I'm like, shouldn't it be low? I don't know. So yeah, definitely check it out. Check out that blog. All right, let's see. There's another one that I thought, this question I've seen come up in the groups. Very good question. When do you suggest coming off certain meds such as Prozac before trying to conceive? The tough question.
Yeah, nope, not even going to touch that one. And I'll tell you why. One, I'm not in the psych field to know what is the best antidepressant for when you're pregnant. This changes all, and I had to deal with this for years when I was in IVF. I consider antidepressant medication real medication, like high blood pressure medication. If somebody's got high blood pressure medication, maybe you happen to be on one that's not healthy for pregnancy. Well, nobody's going to tell you, just go off everything. You'll get high blood pressure. Well, depression is just as serious. So I don't recommend people come off antidepressants, but I know darn well there are perfectly healthier antidepressant medications to take when trying to conceive and getting pregnant. So just, the doc that prescribed the Prozac will tell you what is the best thing to be on when you're trying to conceive. And listen to them. Don't shy away from taking it. Your mental health is critical to this. Your baby needs it. Everybody needs it.
Thank you. Yes, we have a follow-up question about chemical pregnancies. How will I know if it's happening?
I already love you too. Thank you.
Aw. How will I know if I'm going into a chemical pregnancy? When does it happen? When will it happen?
Well, a chemical pregnancy is a pregnancy. So it happens when all pregnancies happen, right? We implant and I start doing on 12 DPO, I start doing my home pregnancy test, and you might see positive, and then all of a sudden, maybe, you know how it is, we're going to do them every day. And then on the 5th test, it starts to get lighter. And the next day it's even lighter. Well, that was probably a chemical. You know, and again, technically a chemical pregnancy is a miscarriage that hasn't been diagnosed with an ultrasound yet. They call it, it's a miscarriage, but it hasn't been confirmed clinically. When you do have an ultrasound, then they call it a clinical pregnancy. Just nomenclature, words.
Okay, let's squeeze in one more question here.
Sure.
My husband and I are having fertility challenges. We have started diagnostic testing, planning to submit a sample for semen analysis. The instructions for the test say not to introduce lube or oral or vaginal fluids. Are there any ways we can make it more physically comfortable for him versus a dry rub?
Well, there is a lubricant called Pre-Seed out there that is like a fertility lubricant. But that being said, I think it's important to, again, I know when I worked in IVF, when we had men who really needed to have a lubricant, it's like, look, if you want a sample, I need a lubricant. So we would supply them with it right from our lab. So you might want to check with the lab that's going to run the semen analysis and find out what they recommend. Maybe they would give you something, but I know Pre-Seed is out there and that's a fertility lubricant, so it's perfectly safe. But I would check with the lab. But I'm glad you're getting testing. Preliminary testing like a semen analysis is great. HSG to make sure your tubes are open. Remember, I just need to get the sperm to the egg. Those are 2 important things. Blood work, like your AMH level, that's not going to help you and I today trying to conceive. However, that will help us know, do I have a lot of time left? You know, I'm 35. I have an AMH of 2. You're great. You're fine. Menopause is a long way off. I'm 35 and my AMH is 0.7. Menopause is going to come quicker than you think. You do not have a lot of time. So again, it doesn't change the daily habit that we have of how we try to conceive, but an AMH is important. But that semen analysis and HSG, those are important to get done preliminarily at least.
Okay, thank you. And that's an hour. So thank you everybody for joining us today. And I know we didn't get to all the questions. We try to get to as many as we can. So you can reach Nurse Linda or one of our pre-mom experts through Ask an Expert, as Nurse Linda said in the beginning, or through a pre-mom called Consult if you need some quick answers. So please check that within the app. And then also we are here on Thursdays. So we welcome you to come back next Thursday. We've seen some of your lovely faces, more like your names. We're mentioning your faces.
And I have to, little Danielle just threw out a question there, so I want to answer her real quick. She had an AMH of 0.8. And so again, I want to reiterate, yes, that means that maybe instead of going into menopause at 55, you're going to go into it at 46 or something. So that's good to know. Right now, it doesn't matter. Your eggs are good. You're fine. It doesn't have anything to do with that. So you keep trying to get pregnant. It just means that your clock is ticking a little bit louder than you would have thought. So, but don't let that stop you right now. That's all. I just want to tell you that, Danielle. Thank you guys for coming. Terry and I really appreciate, I respect when you guys give us your time like this. I hope you find this helpful. I love all the love that you guys give us. We're giving it right back to you. And like I said, always come visit me over on Ask an Expert. You can get question credits or join a membership. Remember that silver membership is like $1. I mean, honestly, when you get the free things, I'm exaggerating, but you get the free ovulation test that costs like $5. So join this stuff because there's a lot of good information there. I want you guys to have that. The more I can reduce your stress by teaching you guys, the better it's going to be. That's all.
All right. See you next week.
Bye, guys.
Good night.
Love you all. Bye-bye.